I would say, categorically, I would say 50% of all the spine fusions that are done are not necessary. I'll say that categorically. At least 50%, maybe even more. And that's a low ball figure.
Perhaps we even go a step back, like how many spine surgeries are conducted in the US per year?
About 800,000 a year. So you take half of those.
So what you're talking about is actually approximately 500,000 surgeries are not needed.
That's right. And who's going to make them accountable? Who's going to say it wasn't necessary? Who's going to step in and make a comment?
Yeah, hello. I'm a physical therapist from Germany. My name is Bruns, and I'm here with Dr. Nordt from Miami. And I've come all the way here to talk about unnecessary surgeries. Dr. Nordt has made me aware of it, even I'm a physical therapist since more than 15 years. I knew that there are many unnecessary surgeries, but I didn't, not even close to it. I was thinking that it is to that extreme extent. And Dr. Nordt has produced a documentary called License to Harm, which has really blown my mind. I stopped counting how many times I saw it because it's loaded with so much powerful content, with so many big implications for all the people. Because who doesn't have back pain, or who will not have back pain in their life? And if not themselves, who of the family members or friends? So I was then thinking it's really worth to come here. I have been writing an article related to sciatica, how to overcome it for good, and the subtitle of it was and is how to avoid surgery and pain meds. And then I was thinking I should write a little bit more about it, and that's how you popped up. So yeah, and then I also found Professor Rosen, who's doing something similar, and some other doctors, but still the word is not out enough, so there's a very big lack of awareness among normal people in relation to completely unnecessary and very dangerous surgeries. I think this should be emphasized. These are very dangerous surgeries, and it's nothing you can reverse once it has happened.
Especially if you have complications.
Yeah, so it's a big decision, and the common misunderstanding here is that it's just a small surgery, and if it doesn't go well, it doesn't matter much. Well, it can matter a lot.
You have really hit the nail on the head on that. Really have. That is so true. There are ramifications, especially when the indications are flimsy or non-existent. So I agree with you. My name is Dr. John Nordt. I'm from Miami originally. I've trained a lot of places. I was a professor at the University of Miami for 2.5 years until about 80 or 81, and then I ended up opening my own office in 83, and I've been solo ever since. Did a fellowship in trauma, spine, did sports medicine, team physician for the Dolphins, team physician for some high school teams. But spine to me is an interesting thought process. Spine to me is not an easy diagnosis. It's not something that, oh, there it is and you do it, like a total hip or an arthritic knee or something like that. And so it's an intellectual pursuit. You talk to people, you listen to them, you examine them, and you try to figure out what's wrong. Put a video together, and I think to try to get the message out to people who are interested in listening, to prevent harm to themselves, is really important.
And also to their family and friends.
Everybody. Absolutely true. Absolutely true. No question about it.
Yeah.
But the thing that drives it is money.
So if we crunch the numbers a little bit, so you've been talking about 800,000, so this is around, let's say, 60,000 per month. So we have around 2,000 per day, right? That's a big number.
Mm-hmm.
That's really a big number. I mean, every day, just 2,000 spine surgeries.
True.
So, and if you talk about, then a large percentage of that is unnecessary. So how much is that per day? Well, we're talking really about big numbers here.
Of course.
So the probability is also very high that the listeners here are really going to be part of that.